This content features my AI-generated voice and an AI avatar. The content, opinions, and professional assessments are entirely my own and are based on my original materials. Using advanced technology allows me to bring you new content more quickly, more consistently, and even more up-to-date insights. Now enjoy watching and listening.
The days of picking a nice picture for your practice website and simply hoping for the best are over. In the modern landscape, online marketing is no longer a dark art, it is a measurable science that aligns perfectly with the principles of lean management. Every digital touchpoint, from the moment a lead clicks your phone number to the final submission of an appointment form, provides us with data that tells us exactly what is working and where we are losing momentum. For the clinic leader, this requires a fundamental shift in focus, from creative aesthetics to key performance indicators. We must move past the subjective and look at the objective. Cost per lead for high-value services and the conversion rate from website visitor to patient inquiry. This quantitative approach allows for precise budget allocation, mirroring the same evidence-based decision-making we require in our clinical treatment planning. In a lean practice, we eliminate the deadly terms like, "I hope this campaign works." Instead, we adopt a disciplined entrepreneurial mindset. We test, we measure, and we refine. Your marketing budget should never be a drain on your overhead, it must be an investment in growth. A high-performing practice should view its marketing funnel as a series of controlled experiments. By testing two different versions of a landing page, perhaps one emphasizing advanced technology and the other focusing on patient comfort, you quickly reveal the prospective patient's actual point of pain. By analyzing this data consistently, we move past guesswork and only scale campaigns proven to convert the specific patient profiles we actually want to see in our chairs. To maximize your practice efficiency, you must focus your resources where the audience actually lives, rather than chasing every new trendy app. The most effective marketing still relies on two primary pillars: search engine optimization and established social platforms. SEO for our profession requires demonstrating deep clinical authority and geographic relevance, going far beyond simple keyword saturation. It involves creating original, in-depth content on high-value topics like adult clear aligner protocols or advanced implant failure solutions. Dominating the local search landscape for these high-ticket procedures is the non-negotiable foundation for a predictable patient flow. Meanwhile, social media's value lies in its unique ability to humanize the clinical environment. These platforms should be used to showcase your team's culture and your commitment to advanced care. Authentic videos demonstrating your workflow, introducing specialists, and sharing genuine patient stories transform a sterile clinical brand into a relatable, trustworthy health partner. We must also remember a fundamental law of sales psychology that many medical professionals tend to ignore. People buy from people. To improve our digital performance, our marketing must communicate emotions before it lists clinical facts. A common mistake is treating a website as a purely informational brochure rather than a dedicated conversion tool. The psychology of conversion demands emotional resonance. We must clearly define the patient's desired outcome, whether that is confidence, relief from pain, or an improved quality of life, before we ever detail the technical aspects of the procedure. The focus must always remain on the transformation, not just the technique. In high-ticket cases like full mouth rehabilitation, trust is the paramount currency. Using short, powerful case study videos that feature the patient's personal journey, often narrated by the doctor, builds instant credibility and reduces the perceived risk for prospective patients who are making a significant financial and emotional commitment. I know that many practitioners feel overwhelmed by the complexity of the digital landscape and respond with a resigned, "I can't." But as we teach in dental leadership, this is a limiting belief. You do not have to master the entire digital ecosystem overnight. The remedy for paralysis is to adopt a Kaizen mentality, integrating small marketing refinements into your weekly operational schedule. While you can certainly delegate the technical execution, the strategic direction and final data analysis remain your indispensable responsibility as a leader. The lean approach is to take the first step. Update one service page this week. Record a 30-second video for your social media tomorrow. By moving forward in small, manageable increments, you build the marketing habit. Over time, these refinements compound into a high-performing digital presence that puts your patient acquisition on a disciplined autopilot. Strategic marketing is the engine of a proactive practice. By treating your online presence with scientific rigor, you create a sustainable, predictable flow of new patients while staying focused on the data and the needs of those you serve. Thank you for your time, and I'll see you in the next video.